Good morning. I'm Alan. I want to thank you for joining our Revolution South Carolina's monthly meeting. Today we will be discussing healthcare in South Carolina. Please introduce yourself in the chat with your screen name and the organization you are with. Put questions for the panelists in the Q&A. We have four great guests with us here today. State Senator and candidate for governor, Macleod, and two healthcare providers, family nurse practitioner, Dr. Lynn, PhD in adult and infectious diseases, Dr. Emilio Perez, Jorge, and Professor Willie Leggett will conclude our forum with a discussion on why our ultimate goal is Medicare for all. So I'd like to welcome Barbara, has just joined us, and of course we have Keith and Hal, and I see the senator has just got on the call here today. So once again, good morning. My name's Alan, and thanks for joining our Revolution South Carolina monthly meeting. Today, we will be discussing healthcare in South Carolina. Please introduce yourself in the chat with your screen name and the organization you are with. Put questions for the panelists in the Q&A. We have four great guests here with us today. State Senator and candidate for governor, Macleod, two healthcare providers, family nurse practitioner, Dr. Lynn, and PhD in adult and infectious diseases, Dr. Emilio Perez, Jorge. We also have Professor Willie Leggett, who will conclude our forum with a discussion on why our ultimate goal is Medicare for all. I think it's time for us now to go to Keith Gray and kick off our August forum.
Good morning. I'm Keith Gray, Sr., CD Vice Chair of our Revolution South Carolina, and I'm pleased to welcome all of you to our monthly meeting, a continuation of our commitment to fight for Medicaid expansion in South Carolina, and parallelly to achieve our goal of health care for all as a human right. We've got so much important work ahead here in South Carolina and across the country. 2020 taught us a lot of things. One of the most important lessons I learned as an activist was that we can never let up on our organizing. Our organizing helped remove Trump from the White House and enable Biden to win it. Now we've got to ramp up our organizing to make sure we can build on those successes and have a government that truly serves all the people. Can someone tell me why vision, dental care, hearing aids are offered as separate insurance? Aren't the eyes and teeth part of our bodies? It's sad to see elderly teethless, deaf, and many who can't see because they cannot afford a pair of glasses. It is unacceptable. How cruel it is that people have to have 2 or 3 jobs to survive. On top of that, none of these part-time jobs offer healthcare insurance. How cruel is it that people have to ration their medicine because of the very high prices? Can the politicians understand the impact of this on families' economic and emotional stability? This is a moral issue. Over 600,000 people have died in the U.S. due to COVID-19. Many deaths were a consequence of a lack of preventive care, in addition to inequalities in the distribution of the vaccines. So the struggle continues for Medicaid expansion in South Carolina and Medicare for all and many other issues. Currently, there are only 12 states who have not expanded their Medicaid program to cover more low-income and struggling working residents, and among them, unfortunately, South Carolina. And unfortunately, many of the poorest citizens in states that have decided not to expand Medicaid are victims of a coverage gap purely for political reasons. Our Revolution South Carolina is firmly committed to tackling social injustices in our state and identifying and working to elect candidates to political office who will fight for policies consistent with our values. In this event, we are joining forces with Healthcare for All South Carolina. We appreciate Dr. David Keeley and his organization's activism. So Today, we are joined by a distinguished panel of Palmetto State leaders and experts as we discuss the healthcare crisis in South Carolina and how the healthcare system works or doesn't, and how it affects people's lives. Before we start the conversation with our special guests, we're going to hear from Hal Ginsberg with Our Revolution National about Our Revolution's membership drive. Welcome, Hal.
Well, thank you so much, Keith. It's always great to be in South Carolina, even if it's virtually. And I think you're just about as hot down there as we are here in Maryland. So I wouldn't be losing anything by going down there and braving the 98-degree heat. We are doing an awful lot at Our Revolution and working closely with Our Revolution South Carolina. And we have been doing this for 5 years now. I'll just start really quickly with a pitch. If you are in a position to join us as a movement builder, $5 a month is all it costs. It does help us continue to organize and put on great forums like this, where we talk to South Carolina leaders and experts on the need to expand healthcare access in South Carolina. ourev.us/SC-MEM, and of course the SC for South Carolina, that will guarantee that the money is credited to South Carolina and will be used for ongoing action in South Carolina. ourev.us/SC-MEM. We are 5 years in the fight, as I mentioned, and here are some of our top issues. Medicare for all. Right now, we're focusing on Medicare expansion because we believe that is doable. It is in the budget reconciliation package that the Senate is considering, and we are focusing on pushing hard Medicare expansion, including in South Carolina with Congressmember James Clyburn. We're focusing on the Green New Deal, defending democracy by passing the For the People Act, canceling student debt, all those super critically important issues. The PRO Act, good jobs for all. There are some good provisions in that Budget Reconciliation Act. We've got to push hard to have those enacted into law, and that's what we are doing. There you can see us pushing for Medicare for all over the years. We have been fighting hard for labor, for working people across this nation, fighting to pass the PRO Act. Ending fossil fuel subsidies. Why is it so hot? I mean, look, I understand South Carolina, Washington, D.C., right near where I am, we're built lowlands, relatively far south. Sure, it's going to be hot. But these record-breaking weeks are, without question, scientists have confirmed, a result of human activity burning fossil fuels. We've got to end the fossil fuel subsidies. Join us in that fight. Here are our demands. This is what you told us is most important to you. Voting rights, health care. That's what we're talking about today. This is in order. Climate change, taxing the wealthy to end the obscene wealth gap and income gap that we have in this country and pay for the programs that we need to make our country as great as it can be. And of course, good jobs for all. Working people just want an opportunity to make a fair living, a fair day's work, a fair day's wage, and that's what we're fighting for here. Again, you can see some of our posters, and I think that represents a revolution recess right now because House is on recess. We are pushing House members and the Senate to maintain what's in that budget reconciliation package and pass it into law. Lucero is leading that fight in South Carolina. If you want to join us in that Our Revolution SC at Outlook.com, ourevolutionsc at Outlook.com. And I think that brings me to the end of my segment. Really, one last pitch. If you can become a movement builder, just $5 a month. ourev.us/SC-MEM. Help us continue the fight. Now let me turn this program right back to Keith Gray, Sr. Keith, I think we've got you muted.
Our first guest is State Senator Mia Macleod, who has a very impressive resume. Beyond representing Kershaw and Richland counties, she's president of Macleod Butler Communications, LLC, a graduate of South Carolina School of Law, and a native South Carolinian. After law school, she worked in the South Carolina Attorney General's office to combat violence against women. So I'm sure she was very familiar with Mandy Powers Norrell. She recently announced that she's running for governor in 2022. Thank you so much for joining us, Senator.
Thanks for having me.
Could you share with us why you're invested in the fight to improve health care across South Carolina?
Sure. I have been fighting for Medicaid expansion and other healthcare related issues. For those of you who may not be familiar with me, I was diagnosed with sickle cell anemia during my first year at the University of South Carolina as a freshman. So I was in and out of the hospitals.
Oh, sorry. We seem to have a little bit of a lag on the internet connection.
Can you hear me?
Now, thank you.
Okay, hold on. We're traveling. I'm sorry about the internet connection. Can you hear me now?
Yes.
Okay. So I was diagnosed with sickle cell anemia during my first year of college. And at the time, I'm from Bennettsville, South Carolina, one of South Carolina's rural underserved communities. And at the time, we did have a hospital in Bennettsville. We don't anymore. And I think it's unconscionable that we would be in a global pandemic and not, and this governor would still not expand Medicaid. Expanding Medicaid would help a few 100,000 South Carolinians who are, falling through the cracks right now. And I can remember when I was leaving state government. I worked in state government before I ran for office in the executive branch for Republican Attorney General Charlie Condon, and then later Democratic Governor Jim Hodges. And when I left state government to start my own firm, I was newly divorced. My boys were much younger. And because of my pre-existing condition, my health insurance premiums every month were higher than my mortgage. And I wasn't able to afford, there were long periods of time where I just had to pray my way through it. I wasn't able to afford healthcare coverage because of the cost.
Mm-hmm.
So, that is always close to my heart because there's so many South Carolinians who work extremely hard, many of them multiple jobs, and still don't have health care coverage. So, that's an issue that I will always fight for, because I know what it's like to have to go without health insurance and to be in that position and have to pray your way through. It just is senseless, especially now. Can you guys hear me?
Yes.
Okay.
If you become governor, is Medicaid expansion first thing on your list, as some governors have done?
Absolutely. Yes, it is. That's something that I can do as governor right out of the gate. And it's something that should have been done years ago. But unfortunately, Governor Nikki Haley refused. And so has Henry McMaster. Even now, as I said, during a pandemic when we're getting pounded once again now by the Delta variant, he has still refused to expand Medicaid to help hundreds of thousands of South Carolinians. deal with this pandemic. And we know that a lot of the South Carolinians who are impacted are people of color. And that too is an ever-present thought for me.
Well, what, as an experienced state legislator, what organizing measures could we take to ensure that we increase the momentum of the Medicaid expansion movement?
When you say organizing measures, you mean what organizing measures can your organization take?
Yes, and individuals.
Well, I mean, I always encourage organizations and individuals to advocate for themselves, whether you do that individually or collectively. I think it's helpful. But when we think about just, the level of engagement, of course, matters. But we are dealing with an issue right now that impacts even those who do advocate for themselves. Redistricting and gerrymandering, the way this state has been chopped up by the Republicans to marginalize the voices of the minority party, it's just inconceivable. But I would never advise my constituents or any voters in the state not to engage as much as they can with us, whether that's by email or letter, or it's hard to really say visit the state house because different measures are in place because of the pandemic. Although the governor just said that he is not going to do anything differently. So right now, people can come to the state house, and some of us require appointments because we have to look out for ourselves health wise, that is, and there is no mask requirement for state office buildings anymore. So lots of legislators and staff members and people who come to meet with us are, may enter the building without masks. So I would encourage your organization and the individuals who are participating in this call to please continue to advocate for Medicaid expansion. I don't have a whole lot of confidence in this governor to lead us on that issue or any other issue, and that is in large part why I'm running. But I do think that it helps to engage with your legislators, both in the House and the Senate, especially if you have relationships with your legislators. I think that we saw during the redistricting meetings that the level of engagement is high on that issue because voters are now understanding the impact, and it is, every issue is impacted by the way those lines are drawn. And the lines were purposely drawn in 2011. They did exactly what they did to swing districts like mine. They packed them with African American voters to further marginalize our voices and to make sure that party lines were drawn along racial lines, so that eventually, every time you see a D by a candidate's name, you will know that candidate is likely to be African American, and every time you see an R, you'll know that candidate is likely a white person. So all of those factors are at play, but certainly I encourage all of us, all of the voters, and every member of your organization to continue to advocate for yourselves individually and collectively, and hopefully we can make sure that the lines are drawn I wish they could be drawn independently, because I don't think that we should be choosing our voters. Our voters should be choosing us. And I know that if those lines were drawn differently or are drawn differently this time, it will go a long way on issues like Medicaid expansion and common sense gun reforms and wages, living wages that working people can actually live and survive on. And hopefully, I'd love to see us get to a point where we can um, thrive on those wages, as opposed to having people working 2 and 3 jobs. So every issue that matters is impacted by those lines that are redrawn every 10 years by the South Carolina General Assembly.
Having participated in one of the Senate hearings, I agree with you. Our people are very engaged, and though the Senate hearings have ended, we need to keep up the heat when the House hearings start.
Absolutely.
Well, do we have any questions for Senator Macleod from our other participants? Andrea? All right.
Yeah, I don't see any, Keith, but I did have a question for the senator. First of all, it's very exciting to have heard that you're running for governor. Do you think you have a good chance? I mean, it's always hard to ask this of candidates, but tell us why you believe you have a good chance to get the nomination.
I have a great chance at getting the nomination. The demographics in South Carolina are changing. And I think that that's giving the Republican Party a lot of heartburn. That's why they have been working overtime to try and suppress our votes. But in the primary, well, let me just give you some highlight some numbers from last year. Last year there were at least 1 million registered voters who did not vote. And that is unconscionable, considering the stakes. The stakes were, in my opinion, at their height. They were higher than they've ever been, and yet we had at least 1 million registered voters who didn't vote last year. That says a lot about the level of connection that the candidates had with the candidates who were running. Of that 1 million registered voters, almost half of them were non-white. So they were people of color. There are 55, in South Carolina, 55% of our registered voters are women. And I can tell you that women across South Carolina are extremely excited about the fact that I'm running, because they know my record on fighting for women's reproductive rights and fighting for pay equity and gender equity and just equity and inclusion in general. There's so many issues that matter to us as women, and we haven't been considered by this governor in particular. But I think during the primary and the general, the demographics are they create a pretty strong path forward to victory for me.
And just one quick follow-up. Again, I'm Hal Ginsberg with the National, Our Revolution National. Do you believe, and you alluded to this, that your position on healthcare would also help you in the general election with Republican voters?
I do. And part of the reason that I am more convinced than ever about that is because I received during the height of the pandemic last year, I received so many calls and emails from Republican voters who were outraged at just the inaction of Henry McMaster and his administration as it relates to this virus. I mean, these are people who, they politicized the virus on purpose, of course, because they simply don't care about anybody but themselves and getting reelected. But during the height of the pandemic last year, I heard from so many Republicans and Democrats alike, Black people, white people, people who were struggling, not just with their own health, but with health and safety concerns of of their family members. And so I do think that doing nothing, especially now with this Delta variant and its impact on young children who can't even be vaccinated yet, kids younger than 12. I think that this administration is doing a horrible job at protecting the people of South Carolina, and that is an issue that they want to politicize, but it really isn't. I don't even think it can be politicized to that extent, because people love their kids and they don't want their kids to be sacrificed for the economy or anything else. And that's what we're seeing. That's what I'm hearing. And that, like I said, that I've only received confirmation of that with the phone calls and emails that I'm getting from concerned parents and concerned voters.
Thank you.
Keith, there was a question for Senator Macleod from Taylor Mitchell. However, I wanted to address it live since they're not in the Zoom call. Any infrastructure questions will be addressed in another discussion. So unfortunately, we will not be taking up that.
Yeah, definitely, we don't want to deviate from our conversation here.
Can I pose a question?
Sure.
Okay, this is Willie looking. Senator, you are obviously aware of the number of Democratic candidates for statewide office over the last, 4 years: Florida, Georgia, Alabama, Mississippi, and Jamie Harris for Senate here. And the South Carolina delegation is all Republican, with the exception of Jim Clyburn. All state offices are held by Republicans. What do you plan? What have you learned from the Democrats that have lost in those states, and how are you going to increase your chances of winning based on that learning?
Sure. Well, I've learned a lot, actually, particularly from Jamie Harrison's loss. I was just with Jamie yesterday, and we kept in touch during after. So he admits and acknowledges that with COVID, he was able to raise a lot of money. Yes, a lot of that money was because Lindsey Graham is so hated around the country. But at any rate, what he couldn't really prepare or plan for was the impact of COVID-19 on the electorate and the safety concerns that he and others had. So it did impact his ability to have people on the ground, because he told me he wasn't willing to compromise their safety. And I totally understand that. This was new and unprecedented for all of us. The Republicans did just the opposite. They ignored the pandemic and went door to door. They had a strong ground game, and they had a strategy in place where the majority of them voted straight ticket, as they were asked to do. And we lost a number of seats in the South Carolina Senate and House. We lost Vincent Shaheen, who ran for governor twice. And we knew that his district was a Trump, you know, was a district that had a lot of Trump supporters. We lost Mandy Powers Norrell in the House, who had recently run for lieutenant governor with James Smith in 2018. We lost Lori Funderburk. We lost Senator Glenn Reese. And that, too, goes back to the redistricting actions of our House and Senate in 2011, because those districts, I mean, that part of their national strategy, as I said before, was to rid the party. Been successful. When what I've learned from Jamie's loss is there are a few things. One is knowing what we know now about COVID-19 and knowing what we're learning about the Delta variant, we are preparing to have a ground game, regardless, that keeps people safe and also gets our messaging out to voters. We plan to reach and touch every voter in the state, even those who have maybe not been touched as much, if at all, before by other candidates, because they are in predominantly Republican areas or Republican leaning areas. That is not our path to victory. Our path to victory is to touch and connect with every voter, because I'm from rural South Carolina. And when you go to hometown cities and counties like mine, I'm from Bennettsville and Marlborough County, and you know, the issues and challenges that they are facing are really indicative of the true state of our state, not just under Henry McMaster, but also, you know, Nikki Haley, and you know, we're coming up on 2 decades of Republican control. As it relates to Jamie and his loss, I think a large part of it was not having a ground game and pulling back all of his people, because that is what he believes cost him, you know, a lot of votes, not being able to touch voters or to connect with voters on the ground.
Well, thank you, Senator Macleod. We really
and I agree that that was a large part of it.
Okay, Senator Macleod, thank you very much for taking time out of your schedule. We really appreciate you participating in this and wish you luck on your campaign.
Thank
Oh, dear.
you.
Breaking up. Well, we'll move on. Dr. Keeley, would you like to introduce our medical guests?
Yes. On behalf of Healthcare for All South Carolina, our state chapter for Physicians for a National Health Program, which champions expanding and improving the federal Medicare program to achieve a universal, equitable healthcare system in our state and country. I appreciate everyone joining us.
Thank you for having me. Can you?
Absolutely, Senator Macleod, thank you. It's now my pleasure to welcome South Carolinians Dr. Lynn Glenn and Dr. Emilio Perez Jorge to today's healthcare forum. They are both committed to caring for the least of these in their respective family medicine and infectious disease practices. They both have many compelling patient stories to share about how the healthcare system in South Carolina falls short for too many of our citizens, as Senator Macleod mentioned. First, we will hear from Dr. Glenn. She has practiced as an adult nurse practitioner for many years at the Orangeburg Calhoun Free Medical Clinic. She's a graduate of Vanderbilt University and also University of Pennsylvania, becoming a certified nurse practitioner. And most recently, she completed her PhD in nursing, and she is committed to serving rural, underserved, and uninsured adults with chronic diseases. So, Dr. Glenn actively advocates for equitable access to health care among underserved populations as her primary professional service objective. Welcome, Dr. Glenn.
Thank you for having me. It's a pleasure to talk about this topic that's near and dear to my heart. I've been in clinical practice for more than 25, 30 years, and it's changed a lot. But the one thing that hasn't changed is we always have an uninsured, underserved population. And I really have, in the last few years, tried to dedicate more time to just advocating for this population and giving them a voice. I think healthcare is a right, is certainly not a privilege. I think all of us deserve healthcare, and also healthcare that's equitable. So I know we are running short on time, so I will just give a quick story about two of the patients that I've had in my clinical practice in Orangeburg. One is a sad story, and one is a success story when I've tried to advocate for timely care. So the first patient that I had was a gentleman who would have been 64 years old this year. He came in about 3 or 4 years ago and had some lab tests done. He had a abnormal prostate cancer test done. And we went through a series of repeating those tests and trying to get him a referral to get that evaluated, get a prostate biopsy. It ended up being, and I looked back at my records, it ended up being 3 years later that he finally got a referral to a urologist. And then it took about 3 to 6 months more to receive the proper biopsy that he needed for a cancer diagnosis. He came back into my clinic about 3 months after the biopsy, hadn't gone back to get the results, was really afraid to go back because of bills. He had a large sum of bills from the hospital that he incurred from the biopsy and several other visits. So I encouraged him to go back. He presented to the emergency room, and he had cancer that was spread throughout his body, and was admitted to the hospital, had kidney failure, several other medical problems, was sent home, and was still in kidney failure, and came back obviously 2 weeks later and was critically ill, and decided not to get treatment and died a couple weeks later. Well, actually a few days later. So I did advocate for this gentleman several times, trying to get him into care, but he was really reluctant because of the hospital bills. So a success story I have is a lady who would have been 64, who is 64 right now. And she had some bleeding, menstrual bleeding that was after, she had already stopped. So I wanted her evaluated for uterine cancer. It took about almost 6 months to get that appointment for her to get evaluated by a GYN. She finally got evaluated, went to the oncologist, and was diagnosed with uterine cancer. She got the proper treatment. She got radiation treatment, and she's now doing really, really well and has had normal checkups since. So that just kind of goes to show you that really without advocacy and really pushing for these people to get the care that they need, it usually doesn't happen on its own. It doesn't happen naturally. It doesn't happen easily. And it doesn't happen without a lot of phone calls, a lot of fighting. And so I just wanted to tell you a sad story and a good story, but we can't sustain this. I cannot advocate for the whole state of South Carolina that's uninsured. I'm only one person. And so, I think this is the sustainable solution is really having universal health care coverage. So I would welcome any questions. And I also want to tell you that as a representative of the Free Clinic Association, if you have an uninsured person that needs health care, look on the South Carolina Free Clinic organization website, and we'd be happy to help them get the care that they need.
Excellent. And maybe one of our program people can put that web address into the chat for folks.
Yeah, South Carolina freeclinics.org.
Okay. Thank you, Dr. Glenn. And we'll now hear from Dr. Emilio Perez Jorge, who, as I mentioned, is an accomplished infectious diseases specialist in the Columbia area. He was born and worked as a physician in Spain, which has a universal healthcare system, before he moved here to the U.S. And here he's been surprised that healthcare is a for-profit business more than a service. His practice is located at Lexington Medical Center. He's currently president of the Lexington Medical Association, and he volunteers in a free clinic. And that's, in his mind, a real sign of the lack of our current healthcare system. So, Dr. Perez says he has other qualifications not worth mentioning, since this talk is not about him, but rather about the inequality of our healthcare system. So take it away and welcome Dr. Perez.
Thank you, David. Thank you to the panelists for inviting me, and for the attendees that are listening. I have also a lot of stories that I could tell you about how the inequality of healthcare in this country is being very harmful and even deadly for many, many people. And especially for those that have, lack of financial means. So it's kind of a form of discrimination based on your financial, social, even racial background, because it tends to affect, that lack of healthcare affects particular parts of our population that are, most in need of getting that healthcare. The only story I want to mention, just to kind of, express one of the weaknesses of our healthcare system, apart from the obvious fact that doesn't cover everybody and that is very expensive, is, the lack of preventive care. I had a patient, this was when I was a resident fairly early in my career, that was around 50 years old. He had been diagnosed with diabetes and blood pressure issues about 10 years earlier. And because of his job wouldn't cover health insurance and he did not make a lot of money, he kind of knew he had the problem. He had been prescribed some medications, but then he let it go. And then when I had actually encountered this patient was, about 10 years after his diagnosis, when he came into the hospital really sick, in acute kidney failure, probably a consequence of both the progression of his diabetes and his blood pressure issues that were not taken care of, because he couldn't afford simple things that, medications and, treatments that could have prevented him from ending, in dialysis and eventually dying, a few years afterwards. And that speaks to, how our system is penalizing those that have less means financially to access the system. The politicians, the people that make money, they have good health care, but the ones that need it the most, sometimes the ones that don't have the means to get, access to health care, are the ones that are paying the price. So that's just one story. I don't want to be too long with, with this. I'm happy to answer questions if there's some from the audience or from the panelists, and if not, I'll keep telling you stories. I have more to come.
Thank you, Dr. Perez and Dr. Glenn. And this is a good time for questions and answers. And I understand we have two questions that we would like to share. I can start out. Can you each comment on how the pharmaceutical industry and the private health insurance industry have negatively impacted healthcare, both in the urban and rural settings?
Sure. You want me to go first, David? I can take it.
Go ahead, Dr.
So, I mean, the pharmaceutical industry, has an advantage here in this country that they don't in other countries. Like here, pharmaceutical industry is for profit, and we all want to be successful. And we want companies to be successful, but there's almost a way that the way they negotiate the prices of the drugs compared to countries like Canada or Spain, where there's a centralized and universal healthcare system, allows the pharmaceutical companies here to set their own prices for medications, even if they're outrageous. And we've seen things like that, in the news, certain companies that increase the prices of medications like 700,000%. So it's a for-profit business that is focused on making money and not focused on providing medications that could be life-saving. So having a universal approach to dealing with the pharmaceutical companies and saying this is a reasonable price, we are going to pay this money, which is will allow you to be profitable, but would allow you to be at the same time something that we can afford to provide to all the patients that need it. So that's one factor that where universal healthcare or healthcare for all would make it easier to deal with some of those costs. Now the other question, David, remind me, what was the second part of the question? What was the pharmaceutical companies? What was it?
Either you or Dr. Glenn can mention just how you see the private health insurance industry have impact.
I'll let Dr. Glenn take that. I know we're short on time, so I'll let Dr. Glenn take that, or I can take it after that if there's more questions about that.
You got cut off, Dr. Keeley. I didn't hear part of the question.
Yeah, I was going to say you mentioned, Senator Macleod Hospital closed in her home county, Marlborough County, and I think you also serve patients from Bam Hospital closed. So, is this part of the effect of private health insurance, impacting healthcare?
Well, I think the biggest problem, and we've seen this with the COVID pandemic, is that private insurance is linked to your job. So, if you're not, if you have a temporary, job loss, which we had many people all across the nation lose their jobs temporarily, then you lose your insurance. And so, not every country has employer-based private insurance, and so that also makes it very difficult. So I think universal health care is definitely would take that component away, that your insurance is linked to your job. So
we have a question. Does American healthcare work well for the affluent, or would they too benefit from a Medicare for all? Dr. Perez, you have a...
Sure. So, the thing about Medicare for all is that it's not based on your financial means. It takes healthcare as a right, as we discussed here, some other panelists have mentioned. Healthcare is a right, so it should not be linked to your financial affluence or lack thereof. So Medicare for all would provide care for everybody who needs it, and would provide quality care. Will provide effective and efficient care to everybody, whether you're rich, whether you're poor, whether you're financially well off or not. And it's like many other services that we take for granted. If you have a fire and you call the fire department, they don't ask you if you have fire insurance. They just go and help you and take care of you. So it's the same thing with healthcare. I mean, it's like it's a right, and whether you can afford it or not, it should not be what guides whether you receive the care or not.
We have a minute or so. Dr. Glenn, do you have anything else you want to add at this point?
I did want to go back to the pharmaceutical industry. I do want to give kudos to some community organizations that really support our uninsured population. Well Vista Pharmacy in Columbia, South Carolina has filled, I think, over the state of South Carolina, I'm trying to find the statistic here of what we did in 2019. Let's see where we go. We had over 500,000 prescriptions filled by the state of South Carolina to uninsured adults by the South Carolina free clinics. Not all of those were from Well Vista Pharmacy, but they had provided life-saving medications free of charge, and just have a wonderful organization. We also have patient assistance programs through the pharmaceutical companies that have been very generous in sending our patients the medications that they need. However, like I said, you really have to be a patient advocate. The patients do not know about these services. They do not know about these resources. The application process is not easy. It really takes, having a PhD to do these applications. But I do want to give kudos to those community organizations that have really supported these patients. And without that, we would not be able to provide the healthcare that we have. So I do want to put a positive note on the resources that we do have.
Okay, that's excellent. Both of you, thank you so much. And now let's go back to our moderator, Keith Gray.
I think you're muted, Keith.
Keith, you are mute.
All right, thank you. Now it's my pleasure to welcome Professor Willie Leggett. Pardon?
What I want to do is briefly identify the problems with South Carolina healthcare system, and talk about the disconnect between the needs of South Carolinians in terms of healthcare and how the system is performing, and the response or the positions of political leaders in South Carolina, and to some extent both Democrats and Republicans, and part of that has to do with the what I would call the abandonment, if you will, of some notion of the public good, and that the government has little or no responsibility to provide for the well-being of the citizens, almost to the point of Thatcher position is that we're not a society, we're just individuals and families. So what are some of the problems in South Carolina healthcare system? Well, as has been mentioned earlier, since 2010, South Carolina has lost three rural hospitals. The Americans' Health Rankings have ranked South Carolina in the bottom 10 states in terms of healthcare. What are some of these indicators? One, access to healthcare. South Carolina ranks 41 or so to access to healthcare. It has the highest percentage of uninsured children in the country, with 14% of families without health insurance compared to 12% of the country as a whole. Secondly, South Carolina had one of the highest percentage of residents who avoid health care due to costs, and which we know the consequence of that is that people don't go and get health care or go visit the doctor, then they're more likely to get serious illness. Number 3, premature deaths. South Carolina has the 9th highest premature mortality rate in the country. That is 410 deaths before the age of 75 per 100,000 people. Nationwide, the premature death is less than 340 per 100,000 people. Low birth rates, high cholesterol, high blood pressure. South Carolina has one of the lowest concentration of healthcare professionals relative to the population. Just 83 mental health providers per 100,000 residents. The 8th lowest ratio in the nation and well below the national concentration of 261 mental health providers per 100,000 people. So how do our leaders respond to this crisis? When they had an opportunity beginning in 2017, and we talked about the span in 2012, and people mentioned the expansion of Medicaid. Well, with Obamacare, as I mentioned, South Carolina was one of the few states that did not expand Medicaid. Nikki Haley stated, as long as I'm the governor of South Carolina, we will not expand Medicaid on President Obama's watch. We will not expand Medicaid ever. We are going to make sure that we take care of the people that we know best to take care. And we don't need Washington help to do it. Now the problem, just as the data indicated, South Carolina has not been taking care of its people very well with health. And it's important to note that even early in 2012, 2013, the argument for the most part made by the anti-Medicaid expansion was cost. Well, now, because of both provisions made, policies coming out of both the Trump and Biden administration, not only will South Carolina get enough money to pay for Medicaid expansion, but they will get more than enough money to pay for it. More than enough money to pay for it. In fact, they will get $600 million more than it costs to expand Medicaid in South Carolina. According to South Carolina expand Medicaid, they will get an additional $790 million in federal funds, while the cost is only $100 million to expand Medicaid. And now I want to say something else about Medicaid, because it is a policy that most people support because it doesn't cost the state anything. In fact, a recent study by AARP indicates that 69% of Republicans support Medicaid expansion. 90-something% of Democrats support it, and 75% or so are independents support Medicaid expansion. So what does that tell us in terms of how we can respond to this crisis? It seems to me that is an opening for those who want to believe that the government should provide Medicare or healthcare to all citizens, to try to mobilize people and organize people both around Medicaid expansion and around Medicare for all. Medicaid, we have to seem to be tied to two, because one, that for people to really begin to understand in a real way the cost of not expanding Medicaid would motivate them, I think, to take some kind of action, write their representatives or whatever. But secondly, of course, and perhaps certainly that's a short-term goal, but there is a need to continue the effort to fight for Medicare for all. It's comprehensive. There's no mean testing. It covers all one's health concerns. So we want to keep that up. From now to 2024, though, it seems to me that the most crucial thing for us to do is to make sure that Democrats maintain the House and the Senate 2022, 2020. We at a very crucial moment here. The country can go the authoritarianism where Republicans are now, and all of what Biden is now proposing is simply gone, right? We're back to worse than we were before. So I think the crucial at this particular moment, what's most important for those of us who care about healthcare for everyone, is to make sure that Democrats maintain the House and the Senate in 2022 and set the country up for a Democrat president in 2024. If we don't win those victories, then everything else is all for a generation or so. And I think it's crucial that we began to talk about what's at stake for the future of this country. Anyway, I'll close with that.
Thank you very much, Professor Leggett. Are there any questions for the professor? No? Okay. Well, again, I'd like to thank all of our panelists, and I'll turn it back to you, Hal.
Thank you so much, Keith. And let me see if I can get got a little freezing here. I'm not sure what the problem is. If folks can probably hear me, I see, but that's good. Let me just see if I can get this slide deck to work. It doesn't want to move on. Sometimes we get that issue. I'm not quite clear why. So we'll just wrap up very, very quickly. I want to thank what a great panel. Just wanted to make sure folks had their asks. I've been putting them in the chat throughout the call. And if you want to do something, we'd love for you to join our fight, our collective fight for healthcare as a human right. We're fighting now to expand Medicare nationally. You can see the link. It's in the chat. That's to sign our petition. If you want to get involved with the South Carolina group, working with Lucero, Alan, and actually me as well, we are pressuring Congressmember Clyburn to support expansion in the House of Representatives. And finally, again, if you can, become a movement builder, rrev.us/SC-MEM. And I believe that is going to take us to one upcoming call. That's this Monday. And I'm excited because Mark Elrich, you can see his picture there. He is my county executive in Montgomery County, and our Revolution Montgomery County worked very hard to elect him in 2018, so we're excited to have him on. Also, you see Khalil Sarin in Cleveland Heights, Ohio. I met Khalil a couple weekends ago in Ohio, and he is just a great person, and we are very excited for him to become mayor in Cleveland Heights. He, of course, supported Senator Nina Turner. Exciting to have Jumaane Williams on. He is a great progressive in New York City, the public advocate there, and Chesa Boudin, who's making great strides to make policing and law enforcement accountable to the people and to bring about some measure of true racial justice in the Bay Area, San Francisco City, California. So that's going to do it. we end our call. I always do ask folks, if you want, we'll do a quick chant, let people go, but I'll say when we organize, you'll say we win. So on 3, 1, 2, 3. When we organize,
We
we
win.
win. Have a great Saturday, everybody. Thank you.
Bye-bye.